I'm sitting there getting an infusion. Our entire lives have been uprooted, and my life to the drug company is worth $1,200.
In this episode, we're going to explore one of the most polarizing and controversial topics of our time: vaccine injuries.
It's the only product in the United States where they cannot be sued for damages.
My guest today is Brianne Dressen, and she's lived through this firsthand.
My doctors didn't know what was going on. My doctors kept asking me, they're like, well, what does the drug company say? Like, they're gone, I don't know.
She was injured during the AstraZeneca COVID-19 vaccine trials.
So I was patient number 1 in this study.
Wow.
Under Anthony Fauci's and his department.
And in a world where the conversation around vaccines can be heated, divisive, and extremely nuanced, demonizing those who've experienced injuries is both hurtful and harmful to all of us.
Your constitutional right to due process, your constitutional right to a fair jury trial, if you're injured by a COVID vaccine, they're automatically gone. Your constitutional rights are gone.
This show is not meant to dissuade anyone from getting a vaccination. It's about Brianne's journey of pain, recovery, and relentless advocacy to ensure that we change the way any and all vaccine injuries are handled so that no one has to suffer the same way again.
We are doing this for humanity. We're doing this to restore the rights of every single American out there.
Join me as we tackle these hard truths and give a voice to those who have too often been silenced.
There was no help that came, and I kept waiting and waiting.
Keeping It Real with Jillian Michaels.
Hi.
Hey,
How are you?
doing okay.
Doing okay?
Yeah.
This is I was afraid to do this one, which I think you know. But I wanted to start by reading your letter to me, because I think that it will give people some understanding of where we're going with this subject matter. And the reality is that neither of us are anti-vaxxers.
Right.
And we'll get to all of that. Both of us appreciate that modern medicine saves lives, but with everything, there's a cost-benefit analysis. And, when you explain to me, this isn't about a vaccine injury, it's about what happened after. So I was like, I don't know about this, man. I'm not a
Yeah.
doctor, not a PhD, I'm not a scientist. I don't know anything about this technology. I haven't done my homework on it. I'm probably not the appropriate person. And then I got this letter, and I do remember meeting, who did I meet at the Capitol?
Noelle.
Noelle, and she's your
Mhm.
book agent.
Yeah.
Okay, so when I was at the Capitol testifying to the Senate about health and wellness with the Maha crowd, Noelle, your person, came up to me and told me about this book. And I was like, yeah. And then she actually followed through and she emailed me. And I was like, oh God, a book about a COVID vaccine injury. Hold on, let me just jump in front of a bus.
Yeah.
And then I got this letter from you. Hi, Jillian. I was the woman who was injured in the clinical trials for the AstraZeneca vaccine. My injury landed me and many others at the NIH headquarters to be researched and treated for our confirmed COVID vaccine injuries. Then the findings of their study were buried. Okay. After we went rounds with the NIH and the heads of the FDA, we realized that they had no interest in addressing the harms. And after learning the drug companies have broad immunity, we started the world's largest COVID vaccine injury support nonprofit with over 36,000 members in the United States and 20 global partnerships. We've built an underground network of physicians, emotional support networks, and a medical grant program that has issued $880,000 to people harmed, double what the US government has paid out to date. We're basically doing what our government should be doing. In addition to advocacy, I filed the first lawsuit of my life against the Biden administration for censorship. and I filed a second lawsuit against the drug company, and that will begin deliberations October 29th. We will be releasing a book on our journey November 19th, published by Skyhorse. As tragic as this sounds, this is an underdog story. Perseverance and resilience. We are not victims. This is a neutral message devoid of anger, heavy on action, but still highlighting the government failures that have led to this situation. Thanks for being willing to explore this tenuous issue. So, I'm not an expert. I don't know anything about this. But what I will not have are victims being further victimized and silenced. So, today, my platform is your platform. Tell everybody your story.
Well, thanks for that. I mean, it's something huge for you to be able to, or being willing to do that. I mean, I understand it just because I've been living this for 4 years now. And I understand just how challenging it is for people that have platforms to be able to speak truth, especially speaking truth to power. So for that, thank you. Thank you, on behalf of my community, on behalf of the people that are supporting us, our families, and our fellow advocates that really do see this for what it is. And so I don't take this opportunity lightly, for sure. So thank you.
Well, it's mutual. And I appreciate your bravery. I appreciate what you're doing. So let's start at the beginning. How does one even become a part of a drug trial, let alone a controversial vaccine that
Yeah,
took 10 months to get to market instead of 10 years?
right.
Start me at go, square one.
I probably should begin, with explaining where I was when this, mentally where I was. So I voted for Joe Biden on November 3rd, 2020. I went in and got my shot of COVID vaccine in the clinical trial November 4th. Now, 4 years later, I'm suing him. So there's a dramatic shift in those 4 years of what has gone on. At the beginning, I was, at the beginning of the pandemic when everybody locked down, I was wanting to show my kids that, okay, we all can come together to help support each other. I have family members that are in the healthcare profession, and they were telling me and my other family members, these terrible stories about what was happening in the hospitals from COVID itself.
Yes.
So, my sister's an OB, and I remember her telling me a story of a young mom of twins who, because of COVID,
Lost the
her,
babies.
yeah,
Yes, I've
the
heard
placenta
similar
clotted up and
Yes.
it killed the babies, and the mother was so upset that she couldn't even hold her two babies. And my sister was so upset, she was like, no, I'm not going to let these babies die without someone holding them.
Oh,
right?
God.
Yeah.
Okay.
And so she's screaming at people in the hallway, and they're all short staffed, right? And she's like, someone hold these babies while they die, right? I mean, it's just terrible stories, right? And those are the things that, as any mother or, any decent human being, that will stick with them and go,
Yeah.
I don't want to be part of this problem, right?
Perfect way to start this one,
I
Brianne.
know,
Thanks so much,
sorry.
buddy.
I'm sorry.
No, we're good. Keep going.
But that's, that type of experience. And so for me, that stuck with me. And I went, I don't want to be part of that problem.
Yeah.
I want to be part of the solution. And I want to show my kids that I can be part of the solution. I want to show them how it is when society goes through a hardship together, how much we can do for each other to lift each other up, right?
Yes.
So that's where I came into it. It wasn't, to like prove something to people or, it wasn't anything like that. It genuinely was because I didn't want to cause other people harm.
Which, by the way, I love that you do bring this up because most of the people, I would say all of the regular people, not the politicians and the policymakers and the people who hold patents for these drugs, Americans most of the Americans on that side of the equation, they wanted the mask because they heard these horror stories.
Right.
They wanted the vaccine because they heard these horror stories. And that's one of the reasons when you talk about vaccine injuries, they're like, you animal, don't you know
Right.
how many died and how many suffered? And it's like, yes, we do know. That's why it's nuanced. But what we can't do is not talk about the fact that we're silencing victims, the fact that what's really going on with this particular vaccine, it was rushed to the market, and now you're demonizing the people that are questioning it, that have victims like yourself on the other side. And that's why the goal here is no American citizen is wrong in large part. The vast majority have the best intentions. And the key is listening to each other and trying to find the balance of how to navigate this world, which you are doing better than anyone. So I get the motivation to be a part of the solution. That makes perfect sense.
Yeah, it's that simple, right? So, I was able to enroll in this clinical trial with AstraZeneca. People are not aware that AstraZeneca was geared up to become a leading vaccine in the United States, and we'll talk a little bit about why that didn't happen.
They're not an mRNA vaccine.
Yes, so it's adenoviral vector vaccine. It's similar technology as the J&J vaccine.
Right.
And J&J also was
pulled.
Yeah,
Yes.
for similar issues.
Right.
So, so I went in, got my shot. But before I got my vaccine, of course, we went through this contract with the drug company. And it was, I want to say it was like 30-something pages long.
Oh,
and
God.
we went through every single page, like very monotonous, initial to each page as they reviewed the details.
To go through that?
No. Well, now looking back, I should have.
Because I've been there, but not with vaccine trials. And then when you're in court, it's like, well, you signed right here. You said you read it.
Yeah.
And you're thinking, of course I didn't read it. It's 40-something pages of a language I don't even understand. And I had a lawyer and trusted my lawyer in all those instances. But now I've learned, like, tell me what's on every single page. Have it looked at with 2 pairs of eyes. When you're talking about your actual health, not just some sort of business deal for dumbbells.
Right.
My God, the fact that they didn't provide you with the finances to retain your own attorney to look at such a contract is madness. You couldn't possibly understand it.
Yeah. Oh, well, and they do this all day long in these clinical trial companies. It's the people that come in and participate were just part of a machine, and it's been very eye-opening now going through that process and seeing exactly where the problems are in that process. But yeah, the contracts is step one.
Okay.
So we went through the contract. The drug company agreed to pay for any and all expenses due to a cost, because of an injury, a research-related injury is what it says. Okay.
I'm just going to take some notes while you're talking so I don't interrupt you along the way. But sorry, go on.
And then, so they have very specific things they agree to, and they agree to provide medical assistance as a result of research-related injury.
Okay.
So, okay, cool. These guys are going to help
net.
me if there's a problem. Yes, exactly. A safety net's there. So I'm like, I felt reassured because of that. Without those lines in there, I probably would have walked out of that office, which for looking now would have been a better decision. But so I get my shot, and within an hour, I have tingling down the same arm as my injection, right? And like when you have a limb fall asleep and it's that painful, prickling, and it's numb. Sometimes the limb doesn't even work right for a little bit.
Yep.
So it was exactly like that, but there was no reason for my arm to be restricted, blood flow at all whatsoever. So I was like, this is not normal. Okay. And then I go home later that night, my vision became blurred and double. So instead of one TV, there were 2.
Oh, God.
And then the sound sensitivity started, sound distortion started, and it just continued, on this terrible nightmarish cascade for the next 2.5 weeks. Where
I can't believe how fast.
It was, So that's why it's like, well, is it really the vaccine? Yes. Yeah. It started right away.
It's actually in Wikipedia, by the way, about this vaccine. I looked at some of the stuff you're talking about, and this is how ridiculous this is. I have quite a few questions for you here. So you were saying at one point you couldn't stand the sound of your husband's pants
Oh, yeah. So, and that was pretty quick. I mean, that was
rustling.
within the first couple of days. So that sensitivity to sound, right? So I go home, and things just get weird that first day. Next day, I get up and go to work, and I'm a preschool teacher, right? And I love those kids. And during the pandemic, little tiny people, little tiny bodies, they were so stressed and they needed consistency, and they relied on me to show up in that classroom every single day, right? So I was going to go, and I was going to be that source of comfort and stability for them. And by the end of the class period, my sensitivity to light and sound was so severe, I had to turn off the lights in the classroom, and I had to put the kids in front of a learning channel, and I was holed up in the corner just waiting for their parents to come get them. And that was the last day that I taught. And from there, I ended up locked up in my room, towels over the windows because just the curtains were not, blocking enough light. And the sensitivity to sound had become so bad that running water was too much for my ears. So that physical reaction you have when a bullhorn goes off right next to your head?
Yes.
Like that, just from running water, okay? And my dog would come in, and just the sound of him panting, that reaction, okay? My husband's pants swishing was too much. My beautiful little girl, who was 6 years old at the time, and little girls at that age, they sing, right? And
Yes.
you could hear her from the opposite end of the house with her just angelic voice, right? I couldn't even be near her. Just the sound of her voice was too painful. And my little boy, who was 8, would come in, and he, just try to comfort his mom, right? And just the touch of his hand was too painful.
So you're ready to hear how it's described on their Wikipedia page? Additional side effects include tinnitus, persistent ringing in the ears, and paresthesia, an unusual feeling in the skin, such as tingling or crawling sensation.
Yeah, doesn't that sound,
Benign.
yeah,
Yeah.
it sounds,
Minimal.
yeah,
It's on Wikipedia.
then it will overrun your entire life. It's to say that it's a, life change. It's a dramatic life change.
Of course.
It takes everything out of you to learn how to tolerate that level of discomfort all the time.
So it's the eyes, it's the ears, it's the skin.
Mm-hmm.
You're walking with a cane.
Yeah. So, and it's the heart. So that paresthesia is moved from one arm to the next, head to toe. It moves with my heartbeat now. So it's still with me every moment of every single day. It's the first thing I feel when I wake up in the morning. It's the last thing I feel when I go to sleep. And the only reason I can go to sleep now is because I've got a laundry list of meds that just dial down the symptoms enough so I can turn it off.
I don't even know where to begin here. Do we start with the fact that it's no longer on the market?
Yeah, let's start there.
Okay. I just found some information on the BBC's website about it, and they claim that they pulled the vaccine because they couldn't treat Omicron. So they claimed that they saved, let's get this accurate here, 6.5 million lives. They gave 3 billion shots. There's 8 billion people on the planet.
Mm-hmm.
They hit over a third of the population with at least one.
Mm-hmm.
And then they said that they couldn't treat Omicron with it. So they realized it was no longer effective, not unsafe. Nobody said it was unsafe in any of the stuff I saw.
Right.
Just some mild side effects that happen to exist on Wikipedia. I swear to you, Brianne, adverse effects straight off of Wikipedia. But, we did a great job. We saved a bunch of lives. It wasn't effective on Omicron. So we bowed out because we're so benevolent and handed it over to the mRNA tech vaccines. That's all I can find about it.
Right.
Okay, so tell me.
So this is a product of the modern day book burning campaign that we're all seeing, for the last 4 years. It's I'm I know so many people that have been injured by AstraZeneca overseas. There's hundreds of people suing AstraZeneca directly for their injuries in the UK because they can, under very specific, pathway there. But here in the United States, the reason it's not available is because after my severe injury, we started noticing that the drug company AstraZeneca was marketing to the United States even before they had their license from the FDA, saying, hey, don't go out and get Pfizer yet. Just hang on, we're coming, right? We have this really safe vaccine. It's really effective. Remember back then, all of them were saying it was like 100% effective.
Of course I do.
And then 90% effective, 70% effective. And then at the end, they're like, oops, it's effective, right?
Yes.
So during that time, my husband
Less severe case.
Yes.
You'll get sicker if you get COVID, which, by the way, I've done no homework on. So I want to be clear. I have not researched this. I know the case behind it. I've heard the arguments on both sides. Very difficult. I even tried to get somebody pro on to be like, okay, tell me where we're getting this wrong here.
Right.
Like, I don't want to live in a world without polio. I don't want to send somebody down the wrong path. Let's present the opposite side of this. No one will show up. No one will show up.
Right.
I have a team that I think you met here.
Yeah.
Calling different people. They won't show up for the conversation who are pro the vaccine for this, which I find really bizarre. But I have heard the arguments, and the arguments are, well, listen, the cases of adverse events are minimal, nominal. And, we argue that if you're this sick from the vaccine, you'd be sicker from COVID, and it's a less severe case. Whereas my personal feeling on this one is based on the following. After trying to ingest a decent amount of varying opinions, don't want to live in a world without polio, okay? Don't want to live, or with polio, sorry. Don't want to live in a world with polio. Don't need to see measles come back, no thanks, right?
Right.
Life or death stuff, I've gotten the vaccines, I've vaccinated my children.
Right.
When I look at this, I'm like, well, wait a second. My kids are going to survive COVID. If you came to me and said, my 76-year-old mother who has autoimmune issues, she wants to get it. We had a long talk about it. I tried to explain to her what I know. She still wants to get it. She's an adult.
Right.
But if it's not life-threatening, if it's not going to stop you from passing it on to another person, which it doesn't, that's irrelevant. Where's the personal freedom to make that decision, which is really scary.
Right. Well,
really scary.
Peanut butter. Very simple thing that everybody consumes, most people consume. If we mandated everybody to have a teaspoon of peanut butter, right, across the country, there would be people that would have problems with the peanut butter.
Right.
And we would never, in common sense world that we exist in, right, in our own reality, we would never expect those people that have problems with the peanut butter to shut up, sit down, scream at them, telling them that they're going to kill other people if they open their mouths about their problem with peanut butter, right? We would allow them to go to the doctors and hospitals and say that they have a problem with the peanut butter, right? We would help them. We would go, okay, probably shouldn't have you have any more peanut butter.
Why do you think we're not?
My personal opinion, and this is after having a front row seat to the shit show myself, right? I wouldn't have believed any of this had I not lived it and seen it firsthand with my own eyes and experienced it with my own body. There is an incredible amount of money that was made. There is an incredible amount of protection that's afforded to the drug companies specifically for vaccines that are allowing them to push these boundaries a little bit further. These are the same guys that brought us the opioid crisis. And now, for some reason, we've given them full blanket immunity in this special little arena, and we're going to expect them to play nice.
I want to walk back for 1 second because I got ahead of myself here. You're injured. I don't know how I missed this step. Surely there was a phone call to whoever was doing this drug trial, right? Like I've got double vision. I can't hear. I'm in pain everywhere. Now what? Because I would think they'd say like, "Oh, don't worry, Brianne, this will pass."
Well, that's what I was hoping for, right? The problem is I didn't get any responses from the drug company. So this is where The
Sorry.
reassurances that came from the contract that they signed with me, those were smoke and mirrors. It's with the drug company, as soon as my injury started, they couldn't get away from me fast enough. There's the test clinic, which is the intermediary between you as the participant and the drug company, right? And they were hounding the drug company, trying to get them to help any way possible. And it was crickets. So we were literally calling them, tears coming down my face, right? Because my life was gone. I was being electrocuted 24/7, okay? Losing all kinds of weight because I couldn't even keep any food down. I couldn't be around my kids. My career was gone, right? And my heart was jumping up 255 beats a minute for no reason, right? I was fighting for my life. And I was like, please just help me. Are they going to call me? And the test clinic said, yes, they know what's going on with you. You should be hearing from their team of neurologists at Oxford any day now. We don't know why they haven't called you. I'm like, okay, all right. Well, maybe they're just overwhelmed because of the pandemic. Okay. So for months, I kept giving them these, excuses like, oh, it's so busy. The pandemic's so chaotic.
Because in your mind, the alternative is just too scary of like, they've completely abandoned me with this.
Exactly.
Like help is going to come. I just need to be patient.
Hang on. Yes.
Yeah. Okay.
And I didn't know what was going on. My doctors didn't know what was going on. My doctors kept asking me, they're like, well, what does the drug company say? Like, they're gone. I don't know. And then, and the test clinic's like, well, what do your doctors say? Well, so there was no help that came. And I kept waiting and waiting and waiting and giving these guys ample opportunity, and they never picked up the phone. They never sent an email, and by this point, so my husband's a PhD chemist.
Oh, wow.
So by this point, he had figured out what was going on. He figured it out before the doctors did.
Wow.
He figured it out before the government did. Well, he started looking into what was going on with actual COVID and long COVID and the role of the spike protein. And that's where, for me, this gets really fascinating because the spike protein is neurotoxic, right?
On the COVID virus.
On the virus, the wild spike, as we call it, right?
Okay.
The mRNA technology and the J&J AstraZeneca vaccine technology, both of them implant a code into your body to generate a spike that is supposed to be very biosimilar to the wild spike.
Okay.
That portion of the spike that is generated by the body is a portion of it, and it's the very point of it, right? Because the spike is like a triangle.
Okay.
The point is the most toxic part. And that's the part that, for whatever reason, they've chosen to have our bodies create when we have the COVID vaccines. So that little spike, okay, that genetic code, and there's scientific documents that corroborate this, so everybody can go out and
do their research.
Yeah, do your research and fact check it, because I only want to talk the real science that's been published and is out there, right? So that spike goes everywhere in the body. The code to generate the spike, it can go into your brain, into your skin tissue, into your ovaries, your testes if you're a male, your endocrine system, your lymphatic system. And then once the code is there, then those cells start generating the spike. So wherever that concentration of spike protein lands in your body, that's where you're going to end up with a spike toxicity problem. Now it's up to the immune system to respond correctly.
Got it. So this is why I had a different vaccine, but I didn't have
a problem.
Like, I'm fine.
Yeah.
I'm fine. What is happening with this?
Right.
It's not uncommon, by the way, though. I had a virologist named Vincent Racaniello on from Colombia, and he's like, listen, there's going to be side effects to all vaccines.
Right.
But the thing with this is not even a vaccine. It's
right.
not a vaccine. It does not stop you from catching or transmitting COVID. It's not even a vaccine.
Right.
Which we still refuse to acknowledge. Like, well, okay, it's a shot. Well, ooh, okay, hold on. Does the risk of this outweigh the benefit? Let's go on a case-by-case basis. You can't even have that conversation publicly.
But you know why that is, right?
No,
Because
I actually don't know.
Okay.
I don't know what the
This
F
is
is
my
going on. I
theory.
don't know. And it is deeply, deeply alarming. Deeply alarming.
Yeah, it's a deep rabbit hole, isn't it? So the term vaccine gives the drug companies full blanket immunity
And this
for their
happened during the
product.
Reagan administration, if I recall, correct?
Yeah.
He like signed some bill and said, don't worry about it. You guys are immune.
Right. So 1986, there was a law that was passed. So way back in the day, right? Because the drug companies knew that there would be substantial harm in some people from vaccines.
Right.
And they didn't want to take that risk. So they went to all of the developed countries in the world and they said, we're not going to make these. Okay. We've got a monopoly here and we know it. We're not going to make these unless you guys provide us immunity. So then what that did is it puts the bill and the onus on the governments. And so in 1986, there was a program that was supposed to be put forth for people that were injured by vaccines that they should apply to this special program put up by the government, which we all know how well the government programs work.
Like a FEMA. It's going great.
Yes, exactly. And this is actually worse than FEMA, hands down. And so you apply to this fund, and these guys may or may not give you an award for your life-altering injury or death. And if you think about the amount of vaccines from 1986 to now, so now we're at like 37 shots that kids get.
I thought it was 70.
Okay, yeah, it's probably 70. Yeah.
I thought it was
so
like
it's
in the 70s
it's an insane,
from like 12 when I was a kid.
Yeah, it's exactly
But
right.
I can't interview Peter McCullough because he's been kicked off YouTube, so I don't know.
Yeah.
I gotta wait till we have a Substack. I swear to God. I actually swear to God. I don't know yet because I haven't been able to do that interview yet.
Yeah, it's book burning campaign for real. So so you have all of these vaccines now. You can't tell me that those just magically happened because there's been that many more diseases since 1986 that have come through. So when you look at their business model, right, the drug company's business model, it's an insane model for them to make huge profits.
Okay.
It's the only product in the United States where they cannot be sued for damages. This checks and balances of suing, if there's harm, this is why the industry has a self-balancing mechanism to make safer products. Could you imagine what would happen with child seats, right? Those little car seats that you put your kids in, if they didn't have
any recourse, any consequence.
Would you trust your child put them into a car seat that was totally protected from liability? I sure as heck wouldn't with my kids.
Because of course you would cut corners for cost.
Correct.
And this little plastic piece is going to save us. And it does come down to this. I mean, you've seen it in industries, businesses I've invested in, but it's like a cap on a bottle for a coffee company.
Yes.
So, nobody's dying. But it's
Yes.
like, do you know that we could save 3 cents on every bottle if we switch out this cap to that cap? And I'm like, okay, guys, whatever, COGS, cost of goods sold. But the thing is, no one's life's at risk, so I don't even care. I'm like, just report back to me, tell me when I need to show up for work. That said, you do that with a car seat. It's like, well, let's make sure that we can save. If we just do this little piece of plastic from China versus this piece of steel from such and such, we could save 50 cents per car seat, amortized over hundreds of thousands of car seats, improves our margin by this much. And it's like, it's business. It's all capitalism, which is a good thing. But when left completely unchecked and allowed to run rampant, you'll profiteer in any way possible. And then there's nobody's left holding the bag.
Right. At the cost of your child, the cost of your loved one's health.
Right.
The risk for everyday Americans is huge. The risk for the drug companies, zero. And that's what I've learned over the last 4 years. If you are injured by a COVID vaccine, you are on your own.
What about a hepatitis B vaccine?
Hep B, you have a 50-50 chance of actually getting some kind of compensation from the federal government after you've been in this system for 7 years. So your child gets a severe injury, it's on you, okay? You're going to get shamed, till the cows come home. I can assure you that these parents of these injured kids, it is brutal what they have to go through. There is a boy that was 16, 17 years old. Actually, his aunt lived in my neighborhood, and I feel so, and we actually talk about this in the book. I feel so bad because before my own experience, she put up that her nephew had died from the Hep B vaccine. It had paralyzed his diaphragm. He literally had to have a breathing tube for the rest of his life. I mean, it's just a
Brianne,
brutal way.
I want to play devil's advocate for a second here.
Yeah.
How do I know it's that? How do I know it's Hep B? What if he, who knows? What if it's a congenital issue?
What a coincidence, right? That it would happen right after.
Oh, I see.
We keep going back to the,
I see.
the timeline.
It's instantaneous.
Correct. And
Got
it's not like they have some other, car accident or some other event,
I
right?
see.
And so
Perfectly functioning child.
Correct.
Vaccine, injury, relatively instantaneously.
correct.
And
that
then
changes your life.
Other cases with similar findings. Hence the reason I can go on Wikipedia and find out about your ringing ears and your tingly skin, because obviously you're not alone, but no one says it's debilitating and it'll ruin your life.
Right.
So now the drug companies totally abandon you
Yes.
due to the fact that, there's this law passed that they're immune. The government is supposed to take care of you. And I want to get to that in a second in the silencing piece. But you do have this contract that I made my one note on. There's
yes.
a contract.
There's a contract.
We have to cover you. You actually have a contract. There's
Right.
an extenuating circumstance here. Most people don't even get this crappy 30-page contract to protect
Correct.
them when they get a vaccine. So why didn't they have to make good on that? Couldn't a lawyer enforce that?
Well, this
You're
is what's-
laughing.
Well, it's because it's so ridiculous. All of it is ridiculous to me. Like I have to laugh about it because the reality is so bad for people. Like for society, this is a big problem that people need to understand. So I'm not speaking out because I was injured. Just want to make that crystal clear. Okay. I'm speaking I'm speaking out because of what happened after my injury.
Yep.
I'm speaking out because of the hangups at the drug companies. I'm speaking out because of what the governments did,
Right.
especially our own government here in the United States, land of the free, right? It's not that. I'm also speaking out because society needs to understand what is at stake if they end up on this side of the fence, which, by the way, people have no choice whatsoever if they get picked off by a pharmaceutical product. You have no choice in the matter. So if you're going to roll that dice, this is what you're up against, right? So I had a contract with the drug company. We went after them and said, hey, you guys owe us, for medical expenses. You owe us for not helping us, medically whatsoever.
And suffering, lost wages.
Right.
Yeah.
We heard from them twice. We got 2 offers from them. One was 7 months after my injury. There was one news story that ran, okay? And they called us and they said, hey, we saw there was a news story. We're ready to issue you a payment. And we said, okay, great. They said for $590. And of course, we said, well, I hope there's a couple of zeros on that. And they said, no, this is what we're ready to offer. And we said, tell you what, don't send us that. Go back, look at the paperwork that we've sent you, because my husband's a scientist, like he's super OCD. We sent them beautiful spreadsheets and receipts, like it was perfectly logged, right? And then they came back with this insulting offer, and we said, okay, go try again. They wired the money to our account anyway.
Yes.
And then we never heard from them.
Yes.
Response number 2 came when a mainstream news reporter again reached out to them asking for a statement. While they were on the phone with her, they said, yes, we've issued them a settlement.
It's the talking point.
Yes.
I know. I've seen it in other industries. I knew exactly when you said
Yes.
they sent the payment. It's the talking point is
Yep.
that we settled it and it's been paid.
That's, yeah. So then literally while I'm in an infusion center
These
getting a
bastards.
medication that costs $3,400 a month, Okay. And I'm sitting there in the infusion chair, passed out in pain, right? Just waiting for the medication to kick in to give me a little bit of life for a few more days, right? Then this email comes through, bloop, here's an offer letter. So my husband opens it up. They spelled my name wrong, and the offer was for $1,200. And you can imagine the colorful language that my husband said at that point. And this was a year after my injury when that offer letter came through. I'm sitting there getting an infusion. Our entire lives have been uprooted, not to mention the trauma that our children have had to endure up until this point, just up until that point, right? And my life to the drug company is worth $1,200. For me to get that $1,200, I had to absolve them of any future payments, release them of, of claiming that they did anything wrong. I mean, all of the things, right? For $1,200. So at that point, my husband finally responded and said, "You've got to be kidding me. Yeah. We've been more than patient with you guys. We've given you more than enough chances." And he ended the email with, "Okay, now I'm mad."
Yeah. Okay. So hold on. I want to get back to that. I got sidetracked for a second here. Take me back to, why is this drug no longer on the market? Because according to them, they couldn't fix Omicron. So as I mentioned, they very benevolently bowed out
Right.
to make room for Pfizer and Moderna.
Yeah.
But why? What happened?
Yeah. So the drug company is pushing in the United States, telling people, don't get Pfizer, just wait, right? And
AstraZeneca is saying, don't get
AstraZeneca,
Pfizer.
Yes. And
to citizens or to our government?
To the citizens, because the United States is one of 2 countries in the world where the drug companies are allowed to market directly to the consumer.
Oh, that's right. I know this.
Yeah.
They're allowed to have lobbies. They're allowed to put advertisements on television and in Europe. And
they can tell you
it's
what
illegal.
you need. Your doctor doesn't need to tell you what you need. The drug companies themselves,
I know this,
can tell the consumer what they need.
Totally illegal almost everywhere else in the world, right?
Correct, yeah.
Continue.
And now I understand why. So,
guess I do too now. Okay.
So AstraZeneca was pushing, and they were like, look, we want part of the big United States vaccination market. Hang on, right? But they weren't saying a thing about vaccine injuries. And at this time, I was fighting for my life at home. So my husband's like, there's something not right. So he reports my injury to the National Institutes of Health. This is in January 2021. So if you go back in time to where you were in January of 21, the vast majority of the country still had yet to be able to even have one dose, right?
Everybody wanted it.
Correct. Yeah, everybody was just waiting
for it.
They were, yeah.
At least when I was in California at that time, it was before I left California. I left in June of that same year. And I remember it was like, my ex was like, "Do you mind if I do that? You take the kids?" Because my parents did it. I was like, of course, get your parents vaccinated. And yeah, everybody in California wanted the vaccine.
Right, exactly. Yeah. So, so the National Institutes of Health, they get a report of my injury. They get a report of another woman's injury that's almost identical to mine, including the timing of a kidney infection.
Oh, God.
Okay. From AstraZeneca.
Wow.
So
right.
The NIH does the right thing. They respond within 24 hours.
They do?
Yes. To my husband and myself and this other family.
I'm floored. Okay.
Yes. 10 days later, they go to AstraZeneca and they say, we don't believe your data. You guys need to start your clinical trial over and try again. This isn't adding up. So they sweep them out of the market in the United States. Boom. So at that point, I was like, okay, maybe we've done some good, right? Because at that point, my husband had looked through several of the initial reports for adverse events from all of the COVID vaccines. And he's a scientist, so he understands, right? All of the footnotes, all of those appendices, all of those little numbers in the little tables.
There's numbers, by the way, next to your tingling in your ears.
Yeah, exactly. Yeah. It's just a number, right? And people forget that every one of those numbers is a person with families and friends and children that depend on them, right? These are people that were at work, right, with you sitting in the next cubicle over. They were at the family reunion, and now they're gone.
Right.
And why is that? Where did they go? Out of sight, out of mind is a real thing.
Okay.
So Yeah, so AstraZeneca was pulled off the market or was removed from the market here in the United States. At that exact same time, the National Institutes of Health started a study on COVID vaccine adverse events, specifically neurological. And this is something else I didn't know
Just
that
on
I know now
AstraZeneca?
from all of the vaccines.
Oh, wow. Okay.
So I was patient number 1 in this study.
Wow.
It was under Anthony Fauci's and his department.
Okay.
He actually met 2 vaccine-injured individuals on site.
Okay.
So, yeah, so we know that he knows. We also know that Francis Collins knew exactly what was going on in the study.
So far, I'm liking what you're telling me, though.
Yes,
So
so-
far, I'm like, oh, I like this. Like, you guys,
Yeah.
get out of here. I, of course, would wonder if they did it because they hold at least a piece of the patent for the mRNA vaccine, but I don't want to go there yet.
Right.
Why do that? So
Right.
let's just presume, let's try to provide the benefit of the doubt here. So far, I'm liking this. You're hurt. Hey, you get out of here. Let's
Yep.
research this again. This sounds wonderful so far.
Exactly, right. And that's
Okay.
where we were at. So at this time, I had connected with several other vaccine-injured individuals from Pfizer, Moderna, J&J, right? And these were all medical professionals at this point. So Dr. Denise Hertz, she's a gastroenterologist in California, severely injured, right? There's several other people. We all lined up to be part of this study at the National Institutes of Health. They flew us out. They did top-of-the-line testing, treatments. I was diagnosed properly for the first time at the National Institutes of Health. 6 months after my injury, they diagnosed me with post vaccine neuropathy. And so there it was on my charts.
Neuropathy is nerve pain, isn't it?
Yeah, it's
Yes.
your nerves dying. Neuropathy is not just, it's not just nerve pain. It's of all of the different painful things, nerve pain is a nightmare.
If I could just say, as a sidebar, to validate your position, I sustained a back injury that resulted in nerve pain. And on a scale of 1 to 10, reserving 10 for only fire, I would put this at a 9.5. I have never in my life experienced anything like it. And it was so much pain that I thought to myself, like, if this continues, I can't live with this kind of pain. And nothing
Right.
took it away. Luckily, over time, with the right help, I healed and it resolved. But I will never forget thinking, this has got to get better because this is unlivable. You can't sleep, you can't walk, you can't function, you can't think. It felt like I may as well have been in Guantanamo being tortured. And every night the pain would get worse. For some reason, it would feel worse at night. And it would be like, oh my God, I go back into the torture chamber the minute the sun sets. And the fear and the depression and the horror over that pain, I can't even compare anything to it. So when you tell me that throughout your entire body, my brain can't wrap itself around what that must feel like for you.
But you get it.
Oh, I mean, I get it. On like a scale of 1, you're at a 10. So yeah, like I get it.
Yeah, it's something I wouldn't wish on my worst enemy.
No.
It's different because I have kids, right? And that was my
Yes, you can't be a mom, can't be a wife.
No.
I remember not only could I not, there's no going to the soccer game.
No,
You can't get off the floor.
right,
There's no like having sex with your significant other.
right.
You're just like, yeah, like, love you. If you find someone else, like, I won't hold it against you. I will never forget it. Brianne, it was bad.
It is,
And that went on for 6 months, maybe.
yeah.
Let alone years.
I'm not laughing because it's
No, I know.
but
You
it
laugh because
just-
otherwise it's like, what is it? Comedy is tragedy plus time. So I'm
no,
at
but
the
you get
NIH.
it. No, we've had all of those conversations in our
Yeah.
It's terrible. Yeah. So this is what they were concerned about.
But I left you at the NIH with
Yeah,
dead
the NIH.
nerves.
Oh, yeah,
My
yeah.
fault.
So NIH.
You said that, and then I took us all the way off the mountain. But now I'm back at the NIH
Yeah.
and my nerves are dying.
Right.
And it's diagnosed by a specialist. It's a post-vax injury. It's not in your head. You're not somatizing post-traumatic stress from some issue when you were 5.
Right.
Like, this is quantifiable. We've got the National Institute of Health validating you here. We have a diagnosis. AstraZeneca, get out of here. NIH to the rescue.
Exactly. Yes. And
Now where are we?
We were flooded with hope at this point.
Yeah,
right?
I bet.
And not only the NIH was making us promises, FDA started jumping in, making promises too. So Janet Woodcock, the head of the FDA at the time, started emailing several of us, like, we're working on this, just give us a little bit more time. There's an email string with Janet Woodcock, head of the FDA, the research team at the NIH, which is right under Fauci's supervision. The CDC is on there. Albert Rula is on this email string with Dr. Denise Hertz, who's the injured gastroenterologist, who's also a participant in the study. And they literally tell her, just hang on for a couple of weeks before you start publicizing this. We want to get all of this information together. So then we can disclose this to the public appropriately. So they bought our silence with these promises over and over and over, while at the same time, we're seeing on the mainstream media what everybody else is seeing is these are 90% effective, go get your shot or else you're killing people, right? There was no mention whatsoever of severe adverse events other than maybe a little myocarditis, go to the ER and they'll take care of it, right? That was the only adverse event that they would be talking about.
And you have people who got the mRNA vaccine there as well.
I'm the only participant in the study that is not mRNA technology. So these neurological adverse events happen from all the brands. And
it has to do with the spike protein.
Has to do with the spike protein. And yes, the particular portion of the spike protein, which is the most neurotoxic that they decided to use. So there's a fundamental flaw. And once again, just like we were talking about before, it may not happen with everybody. It's, there's obviously something within certain people's immune systems that causes them to either generate antibodies that attack the nervous system instead of the spike protein, which is probably what's happening in my case.
Dysfunctional inflammatory response.
Yes. And there's, so with our research that we've done, we've learned that it's a combination of inflammation, autoimmunity, and allergic response. So when you put those three together, it's a multi-system syndrome, and that's why when people do have these issues, they really will not know where to even begin when they go into the doctor's office to say what's going on, because there's so many things happening at the same time.
Everywhere.
Yeah, pain everywhere. Your heart will be doing different things. All of a sudden, your GI tract will turn off. Your limbs all of a sudden will be numb and you can't figure out what that's about, right? And then especially as a female, females inherently get gaslit by physicians through, the allopathic corporate medical system, actually. So it's the perfect storm for these severe, debilitating syndromes to be completely dismissed and, just kind of put into a corner.
Why would the NIH even, just I guess to shut you up, just to placate you then? Because what did they do with the research?
Well, and this is what's so frustrating, because not a single person that we sent to them got gaslit by them. There wasn't a single person that was complaining of a self-reported vaccine injury that was not validated by the National Institutes of Health.
Nothing with it?
They did nothing with it. So they all of a sudden, at the end of the summer of 2021, right, they had bought our silence all through the summer of 2021.
We got you.
Yes. And then all of a sudden,
roll out.
Silence.
Oh, God. Okay.
And then all of us had found each other by this point, right? And so we're talking to each other and we're like, what now? They can't do this and tell us that we have vaccine injuries. The U.S. government cannot tell you have a vaccine injury and then not use that information and go inform the public. That's like a major...
That's the point.
Yeah, exactly. It's beyond unethical, right?
So the whole point here is that injuries happen, right? And even if they're nominal, and I remember watching you in an interview. This was like 2 days ago. I watched you in an interview say, listen, when we started this trial, we knew some of us were going to pull the short straw.
Right.
And it's like, okay, well, yeah, injuries happen. Well, they're nominal. Well, you're rolling the dice. Okay. But if you take away someone's choice to roll those dice even, right? And they do sustain this injury, then there are, as you're telling me, supposed to be all of these different safety nets to catch them and support them if they're injured by Hep B or injured by a COVID vaccine or whatever the heck else. Vaccines have injuries. All of them do. There's side effects. They differ. And the rate in which people suffer from them differ. Again, I would choose, I had to make this decision about my teenage daughter, which, I'm sure people will freak out, but it was with HPV.
Mm-hmm.
And I called my ex. I'm like, okay, she's 14. We're at the doctor. They want to do it. What do you want me to do? She's like, what do you want to do? I'm like, I want to give it to her because here's the thing. I know there's going to be the mom that doesn't give it to their son, and I don't judge her because the son's not going to get cervical cancer and he's not going to get this, he's not going to get that, but she will.
Right.
And God forbid, it's extremely rampant. I want to roll the dice on it. She's like, okay, I trust you. And I was like, well, don't trust me. I don't know. I was like, I have no idea.
Right.
Don't trust me. I'm looking at the cost benefit analysis.
Right.
And I don't I know we chose to do it. Point being, if you make that choice and there is an injury and there are injuries, all this stuff is supposed to be there to save you.
Right.
It's supposed to be there to protect you. And then none of it was there.
None of it.
That's your whole point. And then they hid the results. And then they took away your ability to speak about it.
Yeah. They knew exactly what they were going to do with us before we even decided to speak out.
Okay, so now you've found each other. Did you hear anything? Did you hear anything? No, no, no.
Yeah. And all of a sudden, all of our follow-up appointments were canceled. They were tracking our progress with the treatments that they had provided us.
Oh my God.
Okay. So it's not like they kind of had a little, fun game with us at the NIH. Like they flew us in. It was a full-on study. They tracked us, they monitored us, and they wanted to see if these therapies were going to resolve our issues, which they didn't. They improved our quality of life dramatically. I went from bedbound to us being able to have a conversation, right? But we're still not cured, and we're still trying to slow this, inevitable neurological decline from these nerves slowly, dying. So, and it's a sad reality, but we were not going to be used as guinea pigs for no reason, right? Like
of course not.
I offered my body up to science twice.
Yep.
Once for the drug companies and to further the science to get us all out of the pandemic, right?
Of course.
And then after there was a problem and it was obvious the drug company was not going to do their part with, fully evaluating the adverse events that were happening and disclosing those to the public, then I went over to the government who promised that they would do just that. And then they didn't. So then what do we do?
So our program to compensate you, which is not the NIH, right? That's like the federal government has some program that was started in 86 of like, okay, Brianne, you fall under this umbrella here and you get this much. This is my drawing of an umbrella.
Yes, great.
And you get this. Remind me to cut that. So everybody,
no,
my umbrella drawing, please.
You know what? As a preschool teacher,
here, I'll just give it.
We give A's on those little finger paintings
and there's
all
you
the time.
Over here, and now you're supposed to get money. Okay, so now where did that go wrong? This is my umbrella. This is
the best.
Yeah, this is no one's ever tuning in again. This is certainly not Rogan. Hopefully you'll end up there and you'll get the appropriate attention that you need. I'm sure we'll have plenty of people who could draw the accurate photo of this process.
No, you know what? My preschool teacher, you get an A.
Thank you. Thank you very much.
Yeah, so compensation is, a whole other element to this. The drug companies were given full immunity, but anyone that makes a pharmaceutical under an emergency situation like the COVID vaccines or remdesivir, you get an extra layer of protection.
Yes.
And so that extra layer of protection removes you from a bucket that's supposed to be funded by pharma over to a bucket that is funded by the U.S. taxpayer. So under this special little bucket, so people that are injured by COVID vaccines, they have to apply to this different fund. You do not get a lawyer. You have 1 year to file. Okay. It's paid by the taxpayer. It is headed by HHS, who was given $10 billion
Human Health Services?
Yes, to increase COVID vaccine uptake. These are the people that are tasked with paying COVID vaccine injuries.
Okay.
So this current program, there's over 11,000 people that have applied, and that's just because they were lucky enough to find it within that very, very, very strict 12-month.
11,000 COVID vaccine injuries.
Yes, specifically, yeah, which is still the largest amount of people that have reported injuries in the history of the United States, by the way. So this program has a 98% rejection rate for these people. As of July 2024.
It's the burden of proof for your injuries on you.
Correct. Yes. And there's every single lawyer that has looked into this program says you have a right to file and you have a right to lose. That's it. So your right to due process, your constitutional right to due process, your constitutional right to a fair jury trial, both of those, if you're injured by a COVID vaccine, they're automatically gone. Your constitutional rights are gone. And I don't take that phrase lightly. We're part of another lawsuit trying to restore those constitutional rights for anyone harmed by pharmaceuticals.
Not the one against the Biden administration.
That's another one.
Wow.
Okay, yeah, so there's another one. But the fact of the matter is that when you have an incredible machine that's backed by hundreds of billions of dollars, literally, in the COVID vaccine market, right? That has full blanket immunity, there is only the taxpayer that has to pick up the bill, right? And you've got all of this money being funneled into the HHS, FDA, and CDC directly from the drug companies. And they are tasked with increasing this product's uptake. These are the exact same people that are then supposed to give a fair and impartial payout to people that are harmed. So as of today, they've paid out a little over $400,000. 41,000 of that was in July of 2024, and then they did a big payout for a death for $370,000 for someone who died from myocarditis. So there's a total of about 13, 14 people that have been paid out of the 11,000. I can't tell you the huge number of people through our advocacy organization that have reported that they've been denied, like Joel Waskog, who's my co-chair at our organization. He's injured orthopedist by Moderna, transverse myelitis, which is direct damage to your spinal cord. So it's in an MRI, like you can see the damage to his body. His application was rejected. There's Steve Wenger, who was injured by J&J. Within just a thin line between life and death, severe chronic inflammatory demyelinating polyneuropathy. So there's the neuropathy term again, right? These are all neurological injuries. He spent months in the hospital, and he still isn't right. And his application was denied twice. There's Kyle Warner, who also is an advocate at React 19. He was injured with severe myopericarditis, professional mountain bike athlete, right? And he testified with us, with Senator Ron Johnson as well. His application, he turned in 30 minutes after the 1-year deadline. It was kicked out, denied. So it's just person after person after person after person. When I applied, the person that called me to say, hey, we've got your application, she basically set me up to be ready for the fact that it was going to get denied. So their own system knows, all the employees within the system, they know that these rejections are just going to keep coming.
And what is the answer? What's the reason?
They want compelling, reliable evidence.
I have it. It's called an NIH diagnosis. That's called Post Vaccine Neuropathy.
Exactly. Yes. And you can have
Ta-da!
You can have the government even backing you up, saying you have post vaccine neuropathy. And according to how this program is run, it's not enough.
Okay.
It's not enough. So
okay.
Yeah, so that's the
other
compensation.
rabbit hole
Yeah.
of like where we're sending all this other money because it's just like forget it. I don't need to do it.
Yeah.
Okay. So now All right.
So speaking out.
Oh my God. Okay, I'm sorry. Here's my other question. Now we have numerous vaccine injuries, but AstraZeneca is gone and Johnson & Johnson is gone, but Moderna and Pfizer are not gone. So do you know an answer for that? Like, what is
It's weird. So we've
were they
looked at
kicked out? Were they booted? Or because AstraZeneca is like, well, we withdrew.
Right. Because, although that's not
what happened.
No, it was just an increased rate of dramatic effects to the vaccines. And so what happened is people just stopped taking them.
But they didn't stop taking the mRNA ones.
Correct. Well,
my mom just got one.
This is what's interesting. So this is where I think it's important for people to see beyond what's happening just within the United States.
Okay.
So the reality of COVID vaccines in the United States, the U.S. is protecting different vaccine brands than other countries like in Europe.
Oh.
New Zealand,
right, because the
Australia.
NIH holds the patent for...
Yes, so they have their little golden child, right? And they're protecting those. That's my own opinion. Just saying that's an opinion, okay?
Yes, I understand. Yes, you're connecting some dots, and this is the conclusion you personally arrived at. Could be right, could be wrong. No evidence of it.
But the facts are...
Yes.
So in Europe, there are multiple countries who have completely banned anyone from getting the mRNA shots up until 30 to 35 years old. Now, with what you understand about the risks to the younger population and, of COVID itself, there's a lot of things that the U.S. just is failing to do that there's other countries that are looking at this more common sense because they aren't, standing to benefit.
There's no economic incentive.
Correct.
It's across the board. You see the same thing. I have a colleague named Vani Hari. She goes by the Food Babe.
Mm-hmm.
And she's, been raising holy hell over the color of Fruit Loops in Canada versus the color of Fruit Loops here. And it's illegal. Those dyes are illegal in Canada, but they're not illegal here. And kids like neon food more than food that's the color of a carrot, which is extraordinarily unfortunate.
Right.
It makes it more profitable. It's allowed here. And the raw economic incentives beget all of these crazy results. And that's a very small, but it's this blanketed problem across the food industry. I would imagine the military industrial complex, the obesity industrial complex, big farm, like all of these things you're talking about is the way the system is set up here. The raw economic incentives do not serve the American people, clearly.
Mm-hmm.
So you're now totally effed.
Right.
You've been left out in the cold. Beat it, or else you can't even fight us. Forget it. Take your tail, tuck it between your legs, and GTFO. Okay, great.
Right.
You decide to take to what? Social media, write a book, I don't know. And then it's,
we decided, we got together and we realized that there were way too many people suffering. And so just like going after the drug companies now, we didn't have a choice. They left us no choice. They backed us into a corner. We had no choice. These people were dying. We had really good, honest people that were ending their lives because the nerve pain was so bad. And there were children like Maddie DeGarry, who's injured in the Pfizer clinical trial, who was totally healthy, active soccer player, super just full of life kid, 12, right? And most people who are parents can remember what their child was like at 12 and just that boundless energy. And then 2 shots, she's in a wheelchair, feeding tube.
No.
She's still there to this day. No. So the drug company reports after the FDA inquires, right? Said, hey, we're getting reports of this child being injured in the clinical trial. Can you tell us about it? And the principal investigator, Robert Frank, who's paid by Pfizer, right, directly, tells the FDA, I don't feel that her severe life-altering state is due to the COVID vaccine.
There it is, yeah.
No explanation on what it actually would be. And this is exactly what happened with all of the other people that are gaslit this way. I don't think that it's that. But then there's no... It's this.
Of course.
It's just, So the FDA goes, okay, great. And that's it. That's the extent of the investigation the FDA did into this child's severe life-altering injury that she's still dealing with to this day. So all of these people, right? So you hear 1 or 2 or 3 stories, it's upsetting. When you hear 20, 40, 100, 1,000, okay? So at this point in the timeline, we know of over 3,500 people that are all dealing with the same thing.
Okay.
So we decide, okay, yeah, we're going to speak out. So then I actually didn't speak out on Facebook because I already saw what was going on with people.
Mark Zuckerberg this is the funny part, is the week that I released an episode with this woman, Dr. Sabine Hazen, who was just, again, explaining that her research on ivermectin as a potential therapeutic was pulled and she was banned on Facebook. He comes out the same week and was like, oh, I really regret this. The White House made me do this.
Right.
And I had Michael Schellenberger on as one of my first shows that I released with Bill at Club Random, talking about how he was part of releasing the Facebook files and the Twitter files and exposing the fact that that had happened. And at the time, you're like, okay, little tin hat, like, I don't know, this is fringe journalism, even though I love Michael. It's not at all. But my point is, like, then you've got one of the best gastroenterologists in the world,
right,
who's done clinical trials for drug companies for 30 years going, wait a second, and then her, and then McCullough, and Corey, and all these different doctors. And then Mark Zuckerberg's like, yeah, all true.
Yeah.
All true. And still, it's fringe.
Yeah.
Still, you're like, oh, okay, Jill's got her tin hat on today. I'm like,
right. Isn't it crazy? So you speak out even just a little bit, or even if people question, wait, I know this person that this happened to, so I don't know about that. You must be a right-wing nutter.
MAGA, yes.
And you want people to die. And so they've put so much emotional electricity into this that when people hear vaccine injury, they don't think medical condition. No. They think politics.
They sure do.
And
then when these people, these savages, utilize that to go after the First Amendment, to save lives. It's not to save lives. It's to stop you from hearing about this. Right. That's what they're doing. It's disgusting. And that's the thing. I just was talking to Dave Rubin. I'm like, Dave, where is this going? Because, we can't let Brianne Dressen talk because she's going to get people killed because they're going to question these life-saving vaccines instead of saying, hey, guys, listen, you need to know that there's always a risk. There's a few short straws in there. You're rolling the dice on X, Y, Z, P, D, and Q. This is what could happen. Make sure to talk to your doctor, analyze your risk, and if you get injured, these are the steps you need to take, and we need to hold the government accountable to pay out the vaccine injured the way it's supposed to.
Right.
So which brings me to, why are you suing the Biden administration? I actually don't know. So I hope I led into that appropriately.
Yeah. So I have never, up until this point, I'd never sued anybody. I had never had any need to sue anybody. I was just an average person living a very normal life.
Okay.
And then got plucked out of, the matrix and have been moved into this horrible reality.
Yes.
And I went to talk about it. I went to speak out about it. And it took me a long time to get to that point. I didn't just go out and go, I'm injured, and, start doing selfies. Like, it took me months and just realizing that there were so many other people like me that something had to be done. So then we connect with Senator Ron Johnson.
Yes.
Okay, so I'm a lifelong Democrat.
Same.
Voted for Democrats my entire life.
Yeah, same.
And
we should start a club.
Yeah, we should.
I know. It's like
I want that party to be my party again. I do.
I was just having this conversation with Tulsi Gabbard.
Yeah.
And I was trying to reconcile it and why won't they change and can't they see? And maybe if they lose all of us, we can't all be crazy. They'll come back. And she goes, this is where we are right now. You have to deal with where we are and what's at stake. And I was like, this is why.
It's hard. It's hard to peel all that back. And I love that she said that.
Because she's like, stop, Jill. This is where we are. And this is what's at stake. And this is what we need to do. I was like, okay.
That's why she should be the next female president.
Dude, don't
I'm
even
just
start
saying.
me. I was like, listen, I don't want to get involved in any of this political stuff. That's like, I'm not here to tell anybody who to vote for. That's not what I do. Like, my goal right now is to just say, listen, here's a bunch of information.
Yep.
Take it and make your own choices. I'm not here to tell anybody to get your vax, don't get your vax. I didn't want my mom to get it. She went and got it. Like, I'm here to say, hey, Mom, I've had these conversations and these are my concerns. You decided with your doctor. She decided her risks were greater not getting it. And I get that. And she made that choice with her doctor. I just wanted her to know going in eyes open, right? But I was like, listen, if you decide that day's going to come, all bets are off. I will run into fire. And she was just laughing on the phone, but she was like, all right, I'll let you know if that phone call is going to come. I was like, well, I'll be waiting by the phone. And she's like, sure.
But that's the best part about this too, right? Because they really have made us feel like if you are vaccinated, you can't love your unvaccinated family members. If your families are partially vaccinated, then they're just as dirty as the unvaccinated. But the reality is, it's like, because I have family relationships too, right? And it's like, I love all of them.
Yes.
And I have several family members that are vaccinated and boosted and, and it's like, we still show up at Thanksgiving.
Absolutely.
And, love on each other. And it doesn't have to be this horrible, polarizing thing. It literally, you can sit next to someone that's been vaccinated and love them and listen to them and learn from them. And just like they can sit next to you or me as someone that's severely injured and has a totally different perspective now, and they can love me and support my kids and my family. We don't have to play into the game.
Nor should we. It has nothing to do with us. It has everything to do with the FDA and the NIH and all of these different government agencies. It has everything to do with them, not us. We're pawns on the board.
Exactly.
Literally. And then they make us think that it's about your neighbor or your mother-in-law or your crazy brother-in-law who's a tin hat, anti-vaxxer, and they're the enemy. And it's like, let's focus on the left or the right hand, and you don't know what the left hand is doing. It's like the ultimate magic trick. It's like Kaiser Soze. The greatest trick the devil ever pulled was making you think he didn't exist and turning all of our focuses onto each other and causing infighting so nobody can see all of this corruption and organize to fight back.
Yep.
So now you are not doing selfies on Facebook, but what are you doing?
So, we started speaking out to the media and to senators. So I initially broke the conversation with my home senator, Mike Lee in Utah. Hard Democrat, full Democrat, with as Republican as you can get, right? So we went into his office and him and his staff, they're like, okay, you got 15 minutes, go.
Stop.
Stop. And that was my first interaction with any politician. So I'm like, okay, here we go. So I start at the beginning, go all the way down, and they just stood there just in silence. And there were several of them crying by the end. And they realized at that point that this is something far bigger than anyone suspected. I think everybody knew there was going to be problems with the COVID vaccines because it was so new.
Yes.
But I don't think people realized it was going to then usher in the greatest degree of harm from any vaccine that's ever been rolled out on the U.S. market. And so he's been fighting, and it's been incredible to see. And then Senator Ron Johnson comes along, right? And at this point, the mainstream media has him painted as like this monster.
MAGA monster,
And so I was very, very, very hesitant. I was like, this, is not going to go well. But of course, there were several of our advocates that were also injured. Like, do you see anyone else lining up to talk to us?
I've made that very clear. Like we in my line of work, Callie Means, who has been championing our cause with regard to policy, and his sister's a brilliant. She was a head and neck surgeon, but she now has switched her specialty to metabolic disease. And he's like, okay, we're going to go meet with Senator Johnson and, we're going to have this event at Mar-a-Lago. And I was like, oh, Callie, I don't want to be. He's like, Jill, your answer is you'll engage with any politician and then let them figure out who is not willing to show up to the table.
100%. And that's exactly what it is. So people are like, how come you're talking to Ron Johnson? It's like, How about the 50 other people that we hit up before we talked to Ron Johnson? None of them would pick up the phone.
Nope.
We had suicide victims talking to Ted Lieu, who was the chair of the COVID committee at the time. I mean, it's not like we just magically said, all right, we're going to pick these guys that are canceled.
They're the only ones that show up.
Right.
You think I'm like, you think I don't want to go on MSNBC and talk about the crap and the food and the chronic disease epidemic? They don't have you on. And when CNN has you on, you're into science. And then Fox is like, Jesse Waters is like, okay, what's going on?
Right.
Well, okay, Jesse, here's what's going on.
Isn't it weird? This is like...
Because
it's like...
Because of the money in it. And everybody is beholden. That's the reality, is that both parties are captured by big money, but you're seeing what money is going where and from who.
Right.
That's the bottom line.
Well, and you keep thinking it's like, they're our side. Like, that's what... So when we approached NPR and New York Times, we thought that they were on our side. We're like, look, we were the first ones to get it. Right? We are the ones that were the guinea pigs. We know exactly what's going on with these vaccines. We just want people to know. So if they have these problems, they can get help quicker. And we kept getting, sorry, we can't make the vaccines look bad. Over. Because
70+% of their advertising dollars come from the pharmaceutical companies.
Right.
That's why.
So they're not on our side.
No.
They're on the side of their sponsors.
Publicly traded. It's about money. The raw, again, Callie means the raw economic incentive just simply doesn't provide for this type of messaging any longer in those mediums. And that's why, thank God, you've got things like Substack or Locals. And that's why people need to start paying, I hate to say it, subscriptions to channels and sources that they trust. Because like I said, I already got pulled off of TikTok for 1 minute long reel about ivermectin potentially being a therapeutic with a very well-respected doctor. I'm like, all right.
Yeah.
So, okay, so Senator Johnson's now involved.
So Senator Johnson gets involved, and we have a few calls with him. He was such a gentleman on those calls. I mean, he listened to every single person that came to share their story with him. He remembered their names. He stayed way beyond the appointment times with every one of these people. So we decided to take a gamble. And we did our first press conference with him in June of 2021. And within 24 hours of that press conference, our first support group got shut down.
What? How? Off social?
Facebook just deleted it. And then 5 days later, our second support group got shut down. We lost contact with thousands of people that literally there was no resource anywhere whatsoever that was validating what was going on with their bodies. And at this point, it was a very dangerous place emotionally for several of these people because they weren't even getting validated by their own families. And then Facebook, boom, disappeared. Like all of those groups were gone. And so, of course, we were shocked. This was when the war against the vaccine injured began from the mainstream media and social media. So this was the end of June 2021 through July of 2021. And through that whole, through that whole summer.
I thought we might be in 22 at this point. Oh, okay.
No, yeah. So through that whole summer, the mainstream media was just hitting anti-vax crap, like don't listen to them. They're hateful, evil,
Crazy lunatics that'll get you killed.
Yeah. And then we can't even raise our voice on social media. And then we all, take our sick bodies, by the way, because I was laying on the seats to fly to the press conference, right? And I was laying through half of that first press conference too. And so it was a big personal sacrifice for each of us to go. And the mainstream media, there were even a couple of people in the room that were crying behind the cameras, right? So we're like, okay, they understand, right? And then the news stories were all about Senator Johnson holds misinformation panel. And so now for me,
lived all of this on my side of the fence.
It's insane seeing it. Like I would not have believed this had I not lived it on my own side and seen like exactly behind the curtain what's going on. And there's reality And then there's what the media is doing, and they are completely different. And I'm like, well, let's, because once again, my preschool teacher is going to come out, right? I'm like, well, maybe it's just a one-off thing, right? No, we do it again. It's same thing. Yes. And every move we make, they double down, triple down, quadruple down.
Yes.
They've got their retaliation ready to go for every move we make. And this is not what the American people signed up for when they rolled up their sleeves to do their part to end the pandemic. They rolled up their sleeves to be part of a solution. And if there were problems, we were all supposed to come together, objectively evaluate what was going on, and improve on that, right? Improve on the technology, improve on the processes by which these people get help. And then also, just move through this together. Instead, we all know what we got, which was a huge propaganda machine. It was shoved down everybody's throats. And at the end of the day, I really do genuinely think that the majority of the country at this point knows that they were lied to. And that's where this is important to remember, because they will do this again. They're not going to stop with this. They've actually just had this machine, it happened before COVID, and now it's just better, in operation because of COVID. They will do it again, and they already are starting to do that with the monkeypox vaccine and these other products. They have put those in an emergency use authorization, which means that those, even though this isn't, well, maybe some people may feel this is emergency. My opinion is that it's not.
But Jay Varma, the COVID czar, there's leaked footage of him explaining exactly what you're talking about.
Correct.
How the studies showed that the drug wasn't effective. I don't know if you've seen this.
Yes.
I actually discussed this with Sage Steele on her show. And Gutfeld, actually. The monkeypox vax was not effective in the studies. In fact, it just showed that proper nutrition and medical care was equally as effective as their medication. So the medication didn't work. But in order to get governments to backstock all of their drugs from this privately owned drug company, they were saying, well, here's the issue. We didn't structure the study right. It does work. It's just, it was, a flaw in the way the study was designed, and we're going to have an emergency with this. So you better buy $500 million worth of this vaccine and backstock it. No, it's all on camera. He's captured on camera as the guy in charge of this company, selling this drug, talking about this loophole and how they're going to exploit it. And then he goes so far as to say, I'm friends with all the journalists at the New York Times, at Politico. I was on calls with them all day. And by the way, his narrative is not in collusion with these journalists, though. He's not like, listen, do this for me. No, he's telling them we have an emergency.
Right.
We need to do this so that he can push that narrative. And of course, they're going to do it because they then supply advertising dollars to all of those different publications. But if you don't believe it, it's in real time, this man explaining it. And this guy, Steven Crowder, who I used to think was some lunatic in his garage. I was like, oh, okay, another tin hatter. Caught it all on tape. Caught this bastard on tape. You think anyone aired it? But all the crazy YouTube journalists?
You said you could spin the results. Like, why don't you just do that?
No, you can spin them so that people won't dump the stock thinking that the company's worthless. So I'm doing that for the reporters and other people so that they could give us it's very complicated, but they could give us something called an emergency authorization, where they would say, okay, your data's good enough for this is what they did during COVID, like the vaccines and everything. They actually had to submit the data, but they took the preliminary data. They didn't wait till the data was followed out for 3 or 6 months because it was an emergency. We need to design more studies, but we also need to keep up the people's belief that the drug works. So that's why spinning it in the media is helpful. Because basically what we're trying to get the media to say is, oh, the drug didn't work because it was designed the wrong way. So they're going to do another study and it'll probably work. And in the meantime, people should prescribe it for that reason as an emergency drug. That's what we want the story to be. but we'll have to wait until the official press release comes out.
That's just one, right?
Yep.
That's just one.
And if you really want to look at how multifaceted this is, and this is something that was deeply upsetting me, that I've yet to, again, do a show on, but I intend to, is the gain of function research. Let's not forget how this started.
Right.
This, come on, it came from a lab.
Right.
At this point, it's like the FBI, the CIA, the Department of Energy, governments around the world are like, yeah, oops. Like all of this misinformation and disinformation, it was gain of function research done with the EcoHealth Alliance and the Wuhan Institute of Virology with an NIH grant.
Right.
It's all there. It's all in the emails from the Senate hearings. And then you see all these bastards discussing at the NIH how to avoid FOIA requests with the other bastards from EcoHealth Alliance. And none of them are in jail. It's effing mind-boggling.
That goes back to this emergency use authorization protection. So the PrEP Act.
Sorry, thanks. Bring me home.
Yeah. So the PrEP Act, those protections, they're not just protecting the drug companies, okay? They're protecting government agents, government agencies, and anyone that is guilty of willful misconduct.
Oh my God.
They protect you even to willful misconduct. So you know that your conduct is going to inflict harm if it is done under an emergency, which is what the government has just done with the monkeypox products now, okay?
Yes.
They're protected. So this is why you're not seeing COVID vaccine injured coming after the drug companies in droves, is because their hands are literally tied. I am the only person in the United States right now that has a lawsuit that may actually go somewhere. There are 100 lawsuits going after this PrEP Act, which is this incredible protection.
Got it.
Every one of them has been shut down.
Why would yours go somewhere?
So my lawyers feel, and not feel, they have a very educated, strategy.
Of course.
My lawyer is actually Michael Connett, who is behind the latest major win with the fluoride, getting fluoride out of the water, which took them 7 years to do. And that's something else people need to be very aware of. So, but he believes that because it's a contract and they've committed to doing specific things in that contract that they didn't do.
Is this our original?
Yes, your one
That's
item.
your freaking loophole.
The contract is the loophole.
I knew it.
So, so October 29th, we're going to go into court and my lawyer is going to face the judge. And the drug company already has put in their defense, and their entire defense is not that I'm injured, not that I have problems, not that there's some other thing.
And you have no legal pathway to get them.
Their entire defense is, PrEP Act.
Bingo.
So we can do what we want.
Yes, I got you.
So,
which they've done to everybody else who wasn't in a vaccine trial.
Correct.
You happen to be, so you have this loophole of the initial contract that said we would take responsibility.
Yeah, so this is going to be one, it's obviously a precedent-setting case, right? Because it's something that hasn't happened, hasn't been brought to court yet.
Okay.
And the importance of making sure that this goes in the way of we the people, because that's how I feel all of these lawsuits are. I feel that we're fighting for every single American, not just ourselves. We're fighting for every single American that could accidentally end up in this spot.
Which happens with all different vaccines.
Yeah, all pharmaceuticals.
All the time.
Food, it's this doesn't need to be held to a different standard than every other product ever implemented in the United States. It doesn't. The vaccine industry is a huge market. It's not this little weak, fragile thing that it was in 1986, right? They've grown this into a beast of a machine, a money-making machine.
Right.
And so is there a reason that they're still being protected to the degree that they are? I personally don't think that that is necessary. I think that we should have those appropriate checks and balances in place. It's insane to think that just because you have a biological event happen in your body, that all of a sudden your right to free speech, your right to fair jury trial, your right to assemble, right, because your support groups get shut down, and your right to a prompt, legal representation, that all those constitutional fundamental rights are gone for the sake of public health, or as I see it,
Just
for the sake of
profit.
pharma profit.
Right.
So that's that lawsuit. The second one, the first lawsuit I ever filed in my life was against the Biden administration.
Okay.
And talking about the censorship from the support groups getting dialed back, okay? We found out a couple of years later
That
why
they
that
did it.
was.
Yep.
Yeah, so
They did it.
my name showed up in these briefings that was put together by Stanford, ironically funded by the Bill Gates Foundation.
What do you mean? I'm confused. The College of Stanford.
Stanford.
How do we get there?
So Stanford was paid by the Bill Gates Foundation to essentially work through this concept called the Virality Project. And what they did is they analyzed everything that was going on in the country that would shift the COVID vaccination narrative. They wanted to know exactly where vaccine hesitancy was going to be driven from. So they were watching social media, mainstream media, different affairs going on all over the country, okay? So they were putting these briefings together every single week, and they were going to the White House. And then the White House would then direct social media companies to censor specific content. So we do the press conference with Senator Ron Johnson in July of 2021. Support groups get shut down within 24 hours, and then the second one 5 days after. Come to find out, all of those activities were being logged by this virality project that was tasked to provide these briefings to the White House. Every single move I made in June and July of 2021 was on that document with my name. And at the end, they said something about, this is what happens when unverified claims of vaccine injury, have a platform. And then all of a sudden, no coincidence that being submitted to the White House at the exact same time that our support groups are getting shut down, we can no longer speak on social media. We also can't speak on mainstream media. So when I saw my name on this document that went to the White House, and all of the after effects.
Like a movie.
Yes. And so it was like, holy shit, Big Brother is watching.
Oh, yeah.
And I had to go get a gluten-free cookie because that's all I can eat anymore. But it just...
You and my wife.
Yeah.
I'm sorry.
Yeah. So it's shocking because this is not what we were raised to believe this country was made of.
It's like 1984.
Yeah. Like...
It's just Orwellian.
Yeah. It's, I didn't realize that, my very legal and ethical moves would be tracked and would be relevant to the White House or a political party of any side, especially my own political party, mind you.
What I'm really trying to understand here, there's a video of Bill Gates talking about the fact that AI should probably be in charge of policing these narratives on the web. I was just discussing it with Dave Rubin. And you had a diagnosis from the National Institute of Health that they didn't even care to explore or investigate, which I'm sure was evidenced in your support group.
Right.
So you have malice and intent here in this lawsuit because that was there. It did exist. And they intentionally threw it away and saying like, oh, she's got no merit. She's got no claim. She's just a crazy person. That's punitive damages.
Right.
Unfortunately, I've been in many lawsuits, not like yours. But when people intentionally know better and they seek to do harm like that, that's very serious stuff, as I'm sure your lawyer
Right.
has told you.
Yeah.
What
But
happened?
we're not actually going for damages, by the way, in that lawsuit.
What?
It's a nonprofit lawsuit. So we are literally going to restore constitutional rights, and that's it. If we win, we get $1 from the Biden administration. That's it. So if people want to come after us and say that we're doing this for money, we're not. The organization that we founded, React 19, none of us have pulled a single dollar for an income out of that organization up to this point. We are doing this for humanity. We're doing this to restore the rights of every single American out there. We're doing this with, a fierce desire to make sure that we the people, are protected, that the rights of we the people come before corporate interests, come before political, agendas. That's the whole motive behind what we're doing. It's about the people. It's about healing people. It's about making sure that we can all have a fully informed, non-polarized conversation.
Most people would have packed it up. At the first rejection, the second, the third, the fourth, being profiled by the government would have intimidated me into silence. And it's only emboldened you. It's only made you stronger. And I have to believe that this is exactly where you're meant to be. So I have to believe that even if, by the way, every single thing you do, every single show you go on, every single person you talk to, it's going to change at least one life. The bottom line is that the more people you wake up, the more are able to resist in their own ways. And I just find you to be an absolute inspiration. Tell me about the book. Tell me where we can get more from you, and tell me how we can advocate for these changes on a macro level and on a personal micro level.
Well, the book is the next step that we've provided for people, and it's perfectly timed for the holiday season. It's going to release right before Thanksgiving. So this book is a non-confrontational way that people can have this conversation with their families. And it's basically, it's my story with a whole bunch of phenomenal people. Their stories weave through the book with mine. And these are just honest people that just happen to accidentally end up in this situation. We call them accidental advocates, right?
Yeah.
The underlying tone of the story is actually love. It's not hate. It's not conspiracy. It's not tinfoil hatters. It's literally what happens when people come together and move forward in love. And that's why this book is a disarming way that if you have family members that have questions, or even family members that are like, screw this, I don't want to talk about this topic at all, this is the book that you can give them, right? This is the first step to get people to come off of those polarized, divided lines, just come back and go, you're right, we're all humans. We all do actually want the same things. We want everyone to be safe. We want everyone to be cared for. We want everyone to be recognized,
Yes.
right? And we can do that together. We just aren't. And so that's the book. We're really excited about it. We've had some really good reviews.
And it's available everywhere. Pre-order.
Yeah.
Pre-order it on Amazon.
Amazon, Barnes & Noble.
So not having to worry about anybody censoring you there.
Yeah.
Okay, good.
Yep. So that's
Yet.
where, yeah.
So far.
And everything in the book is, it's backed up by fact. We don't go into the weeds at all on this issue. It's pretty surface level. And like I said before, we're just really trying to connect here first.
Gotcha.
There's nothing like this on the market. There's not. You're not going to get this anywhere else. And there's, lots of little secrets in there, conversations we've had with very high up officials that are, that we disclosed for the first time ever in the book. And it's interesting because there's people that on the official level that we can't figure out if they're friend or foe. And still it's that case. There's several people within the government that are trying to get the word out. They're trying to speak the truth. And it's it's interesting working with those people and seeing exactly how they're trying to maneuver under this, the cloak of power that they have to, tiptoe around. So
we understand what you're saying.
Yeah.
Yes. And it's like mental judo.
Yes, exactly. Yeah. And it's the craziest strategy I think, and anyone would have to figure out is on this topic. But then also there's our advocacy organization. It's React 19. Like I said before, we are a registered nonprofit in the United States. We have the largest membership of COVID vaccine injured in the world. And we have an underground network of providers. So if you're a provider and you're willing to help a 12-year-old girl or a 60-year-old that's in a wheelchair or a 30-year-old mom, please reach out to us. We're always looking for competent providers that can just validate these people and give them a place where they can say, oh, I'm not going to be gaslit today. So that's step one. Step two is the compensation program that we have. We've issued $880,000 to people in the U.S. for medical expenses only, for out-of-pocket medical expenses. And like we talked about before, the compensation program is failing, which is why there is a huge need there for contributions for that fund. People can donate directly to that fund, and every single dollar they donate will go into the hands of someone who needs it. And so, as a little bit of a precursor for that, the need for that has never been greater. There's 15 people currently on the waiting list for that. These are people there's one woman who, she's in a care home, and her family members are trying to get her put into a permanent facility when all she needs is a trip 2 states over to get to a medical provider that we already know where she needs to go to get her the therapies that she needs. But we just need to get the money to get her there, right? And so these small heroic steps we do on a daily basis, but every single one of those steps takes a little bit of money to get someone to where their life can be changed.
Get her there.
Oh, for her, it's about $10,000 to $15,000.
You can do $10,000 to $15,000, guys. I'll do some of it. We can do 10 to, come on.
Well, and that's what's so nice about it. Cause if every one of your listeners put $5 in, $10 in, you could change someone's life, 2 people's lives, 3 people's lives. I mean, and the expression of gratitude from these people when they literally get a little bit of a change in their trajectory and their health is incredible. They go from, you know what, I was facing death, I was on my way out the door, and now all of a sudden I can take care of my children. I can sit with my child in a chair for 5 hours a day, and they will tell us, thank you for making that time possible for me and my family. I mean, these are the type of, the feedback that we get. And it's literally because these people have been stripped of everything. They've been stripped of their health. They've been stripped of their dignity, their sanity, their support systems, right? The world is moving on from COVID altogether because it was so toxic. People are just like, shit, I'm done, right? They don't want to hear about it. But all of these people have been left behind with COVID. And the need there is substantial. And so that's what the advocacy organization does. That's the heart of what we do every single day. And then, of course, obviously there's the lawsuits that when we do find pathways that will help people have constitutional rights, then we go after that as well. But the foundation is just to get these people whole, restore their lives, and even just giving people a little bit of hope to have them hang on for another month or 2, maybe even a year. It's life-changing for people. And these people obviously have left a big imprint on me that I can't turn away from them.
Of course.
And I never will be able to.
I think you're so special. I'm so impressed. You inspire the hell out of me. I'll put all of this stuff in the show notes. I'm going to buy the book. I'm going to make a donation today. And if there's anything I can ever do, I'm humbly your servant.
Thanks. I appreciate that.
Thank you so much for watching. If you enjoyed the podcast, please like, comment, subscribe,
and share. And make sure to let me know what guests you want to see on in the future.